overall research agenda is on reducing health disparities in a pediatric population, and most of that research has focused on a population of children with sickle cell disease. Sickle cell disease is an inherited blood disorder. It predominantly affects minority populations in the United States. Children with sickle cell disease are at 300 times the risk of a stroke and 100 times more likely to have a serious infection than a child that does not have sickle cell disease. Another common morbidity is excruciating pain crises. These pain crises are absolutely debilitating and can come on without warning. Most children are hospitalized at least once a year with a severe pain crisis. Much of this can be prevented, and my research generally focuses on, are these kids getting the preventative services that they need? And if not, why not? The research that we've looked at transcranial Doppler TCD screening rates and antibiotic prophylaxis rates among the age groups that they're recommended for. We've looked at them across many, many states, really in-depth in the state of Michigan, in numerous Medicaid populations as well as within health plans. And all of that data brings us to the same conclusion that these rates are very suboptimal. Only about 1 in 3 kids receive recommended transcranial Doppler screening, and less than 20% of kids receive the antibiotics that they should. This is very concerning because these are not new recommendations. This is not new knowledge that this can improve lives for these kids. This has been known for decades, yet the translation to this actually happening to improve the quality for care of kids with sickle cell disease has not happened at this point. Quality measures assess processes or patient experiences or different aspects of healthcare that lead to high quality care. One thing that I think is important for quality measurement is that since it can identify opportunities for improvement, it can also identify health disparities. So it can reveal places where maybe some groups are getting a higher quality of care as opposed to other groups, and then we can think about ways to narrow that gap so that everyone is receiving equitable care. Within the Q-Metric project, we developed 2 measures focused on the care for children with sickle cell disease. The first one is the receipt of transcranial Doppler screening among children with sickle cell anemia, and the second is appropriate antibiotic prophylaxis among children with sickle cell anemia. Prior to these measures that we have developed, there were no measures looking at the quality of care that children or adults with sickle cell disease received within the healthcare system. I think that sickle cell disease for a long time has not gotten the attention and focus from policy that it should. And so I'm hoping that continuing to show that the rates of preventive care are suboptimal, even after decades of evidence showing the importance of this preventive care, will hopefully start to move policy forward in ways that can impact these kids' lives.